Professor here at Wingate enjoys a tasty morgue and a nice bottle of aspirin. Next we have Dr. Elizabeth Reagan. She is also a multifaceted professor here. She is a run-loving, fun-loving, yoga-crazed mother of two.
Hey guys, I'm so happy to be here.
And last but certainly not least, please give a warm welcome to award-winning, world-renowned actor, Mr. Samuel L. Jackson. All right, here is our board. Trying to guess a diagnosis, or hopefully we will know it. All right, Dr. Morris, how about you lead off?
Okay. I'll take general for 100.
General for 100. All right. This is a chronic autoimmune neuromuscular disorder which affects all races, ages, and genders. It is characterized by fluctuating weakness of the voluntary muscle groups. I'm sorry, we're out of time. What is the definition? The definition of the disorder is what we were looking for. All right. Board is still yours technically, so let's keep going.
Let's keep it rolling. We'll go general for 200.
General for 200. This disease results in as much as an 80% reduction in the number of ACH receptor sites on the muscle fiber inside the neuromuscular junction caused by an antibody that destroys or blocks the receptor site.
Ooh, that's just too loud. That's really messing up my chakras right now. So from here on out, I'm just going to say namaste.
I'm sorry you're out of time. Please, reminder, you have to buzz in. You can't just say namaste. The answer we are looking for is, what is the cause? The cause. That's what we were looking for there. All right. How about I take over? I'll just go general for 300. Unfortunately, the only option people with this disease have is managing the symptoms and hopefully going into remission because there isn't one of these. Yes, Mr. Jackson.
Have we even started yet?
Yes, a couple minutes ago. Okay, holding on to my butt. I'm sorry that is wrong. The correct answer is
Yes.
we're looking for a cure. All right, let's go back to the big board here. We are 0 for 3. Let's go over to something hopefully might be a bit easier: prognosis or symptoms. We're looking for either prognosis or symptom here for 100. Pregnancy is possible for a woman with this disease, but careful prenatal care is important. The baby may be temporarily weak and require medications for a few weeks after birth. It usually does not develop this disorder. Yes, Dr. Morris.
What is prognosis?
Yes, finally got one. Yes. That is the correct answer. Let's move along now for 200. Studies have revealed that with treatment, most individuals with this disease can significantly improve their muscle weakness and lead normal or nearly normal lives. Some cases may go into remission temporarily or even permanently.
Namaste.
Dr. Reagan, you can't just say namaste. You actually have to buzz in. That's what the buzzer's for. Samuel Jackson, Dr. Morris, the floor is still yours. Yes, Mr. Jackson.
She said no more stay.
Right?
No, that is incorrect. I'm sorry. The answer is, what is a prognosis? Remember, prognosis or symptoms is the category. Not she said namaste. All right. For 300 now. Fatigue, hoarseness, or changing of the voice, double vision, difficulty maintaining steady gaze, and eyelid drooping are all examples of these. Yes, Dr. Morris.
Charlie, it all links back to this. Do you know what this is, Charlie?
I don't. Are you picking fruit?
This is a heart.
Oh.
And it's all begins with this, in homeostasis.
I'm glad it does, but that is incorrect. The correct answer was symptoms. Remember, we're in the category of prognosis or symptoms. It's right there on the board. Okay. Moving along to 400. Patient may suffer from difficulty breathing because of weakness of the chest wall muscles, as well as difficulty chewing or swallowing, which can cause frequent gagging, choking, or drooling. Patient may have difficulty talking, climbing stairs, lifting objects, or rising from a seated position. A physical therapist may notice a drooping head, facial paralysis, or weakness of the facial muscles.
Namaste.
No! Mr. Jackson.
Think water moves fast? You look at the
And that's all the time you have, Mr. Jackson. I'm sorry, the correct answer, of course, was what are symptoms? Okay, let's just move on to our final category. Tests or treatments. I remind you, this is tests or treatments. We're looking for either tests or treatments as an answer. There's only two answers, tests or treatments. I hope that's clear. Having some trouble. For 100, a physician performs a detailed neurological examination, looking at muscle weakness, usually affecting the eyes first, yet showing normal reflexes and sensations, is an example of this. Yes, Dr. Morris, please, by all means.
I'm going to try to convince you that the medicinal chemist has a multitude of drug receptors for which to target. Am I making any sense?
Not making any sense. Tests or treatments, Dr. Morris. That was neither a test nor a treatment. You are incorrect. Answer is tests. Keep on going. Let's go. Whoa, wrong category. Just kidding. For 200. Anticholinesterase agents allow acetylcholine to remain at the neuromuscular junction longer than usual, so that more receptor sites can be activated. Corticosteroids and immunosuppressant agents may be used to suppress the abnormal action of the immune system that occurs in this disease. Intravenous immunoglobulins are sometimes used to affect the function of production or production of the abnormal antibodies also. These medications, please, are an example of what? Yes, Mr. Jackson.
Truth is, Charlie, I should be asking you the question. I'm trying real hard to answer the question.
What?
What? What ain't no country I've ever heard of?
Wait, guys,
English
guys,
is what?
guys, let's just
Say what again, mother?
Meditation Nice long breath out.
I'm ready. You have an answer.
What is treatment?
Yes! Yes!
You get
All right. Let's try to finish out the category, shall we? Single fiber EMG, electromyography, ACH receptor antibody testing, and office tests such as sleep, ice pack, or edrophonium tests. Keyword here is tests. Can be used to confirm a diagnosis and are examples of these.
treatment.
No! The answer was what is tests?
I think you should
If
do
you
it
would
for
have paid
300.
attention, Dr. Morris.
I think you should do it for 300 too.
For 300 as well?
Yes.
Okay. Dr.
Professor
Reagan?
treatments for 300. There you go.
Dr. Reagan, you didn't answer correctly. You get the question. Plasmapheresis procedure removes the abnormal antibodies from the plasma of the blood. The improvement in muscle strength may be striking, but is usually short-lived since production of the abnormal antibodies continues.
Namaste.
I told you you had to buzz in, but fine. What is your answer?
What are treatments?
Man,
Right,
thank
right,
you. Yes,
right?
good job.
Treatments?
Good job, Dr. Reagan, with that one. Treatments was the answer. Since we were at the jumping off point, let's jump off this bridge, shall we? And go back to general for 400 since we failed to get that one before. This surgical procedure lessens the associated weakness and can even cause the weakness to disappear. You know what? Guys, I'm about done.
What is thymectomy?
That's actually right.
You see, patients with this disorder who have a tumor always have it removed because it could be benign or malignant. Now, this may seem a bit esoteric.
Alright, let's move along, shall we? Alright. Since we have completely failed at this game of Jeopardy, let's move along to the final Jeopardy. As a review, this is a chronic autoimmune neuromuscular disorder characterized by fluctuating weakness of the voluntary muscle groups. It is caused by a significant decrease in up to 80% in the number of ACH receptors on the muscle fiber at the neuromuscular junction. It results in muscular weakness and fatigue. This affects 20 out of 100,000 people in the U.S. of all races, ages, and genders. Some of the symptoms include drooping eyelids and/or head, fatigue and weakness of voluntary muscles, double vision, hoarseness or changing of the voice, difficulty with breathing due to a weak chest wall, chewing or swallowing, rising from a seated position, talking, maintaining a steady gaze. Diagnosis, prognosis, and treatment of the disease, along with a detailed neurological exam. The following tests are used to diagnose this disease: electromyography, ACH receptor antibody testing, the ice pack test, repetitive nerve stimulation. Although there is no cure for this disease, it is still possible for a person diagnosed with this disease to live a fully functional life. Some of the treatments include medications of anticholinesterase medication, corticosteroids, immunoglobulins. Some of the procedures include thymectomy or plasmapheresis. Having said all that, what is the diagnosis? For the sake of going in some sort of order, Dr. Morse, please go first. As always, and will always rule. I'm sorry, that is incorrect, Dr. Morris.
That is not incorrect. But right, disagree.
Okay, Dr. Reagan, you answered not enough yoga, and you wagered my PDE points. Not only is that incorrect, I now hate you. Mr. Jackson, do you have the correct answer? And you answered, the question is for me. Who survived a handful of snakes? That is incorrect, but yes, you did. Class.
Don't press it.
Class, what is the disease?
Hold up your signs again. That's good.
Nice job.